And good morning. It is 20 minutes after 9 o'clock, and joining us in studio this morning from Lovelace Regional Hospital, Rocky Rodriguez, occupational therapist, with us this morning. Good morning, sir. How you doing today?
Good morning. How are you?
Doing good. How's life at Lovelace this morning? You keeping busy?
Oh, yes, sir.
Good deal.
It's awesome.
So April is Occupational Therapy Month. I know we, the public, don't keep up on all these. I mean, we know the big ones like usually October with breast cancer awareness and all those. But a lot of the other ones, the medical professionals keep us up to date on that. But really, with making April Occupational Therapy Month, the whole point behind this is just to remind folks to don't overlook physical therapy, those things. If you're in need of these services, don't try to go on your own sometimes, thinking to remind you, hey, see a specialist. They can fix that. You don't have to deal with these nagging issues that you're dealing with. There's people like Rocky here that can help you fix that kind of stuff. So let's talk about the difference, because we were just talking. You're head of the physical therapy side at Lovelace, right? But you're actually the occupational therapist. So even though you do all physical therapy, you're kind of actually in the office doing the occupational. Like when you're working on patients, it's on the occupational therapy side. Yes, sir. Good deal. So yeah. I guess maybe we should start there. What's when we think of physical therapy and we think of occupational therapy, I think a lot of us lump it all together as, rehab of some kind. Are we close, or are we way off on that? What's the big difference?
So occupational therapy, the main difference is we work with clients in their functional capacities of occupations.
Okay.
Such as, a toddler needs to learn how to navigate and play with toys and stuff like that.
Okay.
As compared to an older adult, needs to be able to function within the family setting, or, cook, dress, groom,
okay,
all that good stuff.
And then so basically it's kind of retraining the body and the brain to do the functions that kind of in essence are in automatic mode sometimes for us. Things we don't think about per se. It's just your brain handles it. Things like, breathing's one off the top of my head. We don't think about breathing, we just do it. But when you move to go pick up that pen or walk down the street, your brain's doing automatic pilot mode stuff all the time too. And so a lot of your therapy is involving reconnecting those established paths, so to speak, and getting the people to kind of make it second nature for them again.
Right. Yes, sir.
Gotcha. Now, what kind of reasons do folks come see? Is it mostly because of either some kind of accident or injury or a medical condition? Or like you mentioned, kids, do you get some that are born with some of these deficiencies that you have to kind of work with as they get a little older?
Autism is a big one.
Okay.
That we work with kids with autism, and in the clinic we see a lot of hands, shoulder injuries, stroke patients, and all that.
Gotcha. And that's so you really see kind of everything. Anybody so you even see some of the sports stuff, like say someone messed up a knee or something and they got to rehab it so where they can function again. You're doing that stuff, but at the same time, a stroke person that's a victim of stroke and they've lost some limited use of part of their body or some of their motor skills, like speaking, things like that. You're working with them to kind of get them into practice and retraining them to learn how to do these things again.
Yes, sir.
It's kind of like now, and this might be getting into the weeds a little bit, but I'm sure each case is different for each person. But is that generally a dysfunction in the brain, or is it a dysfunction in the nerves and the various paths that go from the brain to the arm or whatever you're trying to control? Is it, or could it be both? I'm just curious, like when you're dealing with these.
It could be both.
Okay.
A lot of the shoulder injuries are just like rotator cuff tears, and hand injuries, carpal tunnel's the big one.
Okay. Yes,
sir.
So and really that's not dealing with brain per se. That's just hey, you use something 100 times, it wears out at a point, and you gotta, it's no, you buy a garden hose. After a few years, the garden hose don't work some more, and you got to replace it. Well, unfortunately, our bodies, sometimes you use that, you're typing or whatever your whole life, and you tend to wear down some of those parts there, and you got to do things to fix them, and or at least make them where you can manage it.
Yes, sir.
on average, how often does like the patients that you have are, and obviously this varies depending on their conditions and what they're doing, but a typical patient, do you see them for a couple months stint? Is it years? Is it patients that you 24, all year round you go all the time? I mean, what's generally your patients like do you have full-time patients that you see all the time 24, or is most of them just, hey, you had a sports injury, you're going to be with me for 6 months, and after 6 months you're done? I mean, what's generally what you see like that?
So typically in the clinic, we see them twice a week for about 4 to 6 weeks.
Okay.
In home health settings or nursing home settings, you see them a little bit longer.
Okay. I imagine you've got staff that does the home health stuff and all that. You're primarily office kind of
Yes.
stuff.
Yes.
Gotcha. Generally, how do people come make appointments through you? Is it through you direct, or do a lot of them come through primary care physicians, or do they get referrals from other specialists? Generally, because I know a lot of times if people say they had a stroke or they had a reconstructive surgery on something, part of the treatment is they get scheduled to meet with you to do all that. But do you get people that just come in off the streets too and say, hey, my knee's bugging me. Can you take a look at it? And they say, hey, you just, I mean, do you get that kind of patients coming through your doors?
Well, you have to have a referral from a primary care or orthopedic surgeon.
Okay.
So
Gotcha. Perfect. So basically, if your knee's bugging you or whatever it is, you need to see your primary care specialist. Let them determine whether this is you're just getting old, you got to deal with it, or no. There's some cartilage here, there's some kind of issue, we need to do it. So they come to you later.
Yes, sir.
You'll be the one.
Yeah.
You don't get a lot of people just say, I've got a thing here. Can you take a look at it today?
Right.
So now I'm kind of curious, what kind of treatments do you do? Is a lot of it like motor skill stuff where you're just making them repeat over? Or is it getting your hands and working things? I mean, what's kind of like your day-to-day stuff? What's it involve?
So we do a lot of exercise and physical agent modalities such as ultrasound, e-stim.
Okay.
We do a lot of hand exercises, finger dexterity, and hand manipulation exercises. All that stuff.
So it's a little bit of everything. It's
Yeah.
it's when you got to get in and actually do procedures.
Yes, sir.
But there much of it is his training. It's it's kind of like an athlete when they're trying to get ready for the football game or the baseball game or whatever it is. They're in the gym working out. They're doing stuff to get ready for it. Some of your side is very much that kind of thing where you're learning to walk again. Guess what you're going to be doing a lot of? Walking practice,
Right.
to get you there. And so there's some of that. I got to imagine, so do you see some of the patients that we see like on TV sometimes? Like if they've been paralyzed or something, and then they learn to walk again, and like, do you get those kind of experiences through your office from time to time?
Yes, sir.
That's
We
cool.
sure do. Yeah.
I imagine that's got to be probably the coolest part of your job when you get someone that maybe can't walk or had a stroke and they weren't able to do things, and now after some time with you, they're able to really do the things that they loved or before. Is
Right.
that probably the coolest part of your job?
Oh yeah,
Yeah.
definitely.
Good deal. How often does that happen? I mean, is that every day? Because, I mean, I see it on the TV, and you're just like, oh, what an amazing moment. But I got to admit, I mean, you're probably seeing several people that are in those scenarios, and so I'm guessing you probably see that more often than you think, don't you?
Right. Yes,
That's
sir.
cool. Where people
Yeah.
learn to walk again or what, or at least get some function. And now let me ask you this. How much of it, because you as a specialist, you're going to, you do everything in your power can do that. But I also know that some of the treatment and things you're talking about is stuff that the patient has to be on board with. Like it's the old saying, you can lead the horse to water, but you can't make him drink. You can sit there all day and say, you've got to do this, you've got to do this, you've got to do this. But if they don't do that, that's going to really hamper. So how much of your job is playing a little bit of the motivator psychologist side of things too? Because let's face it, I'm sure you deal with patients and they have a day where they're getting their butt kicked in rehab and they're getting down, and then I guess then your job kind of turns from therapist to coach and saying, you know what, you could do one more. You can do, so you got a little gym trainer in your background too, don't you?
Yes, sir. Yeah. And motivator is
Yeah.
the main thing.
Yeah. But I mean, is that something did you realize when you do it, or was that? I'm just curious. Like when you got into this line of work, was that like a draw for you, or I mean, now that I'm thinking about it, I guess the question is, what drew you to physical therapy and occupational therapy? What did it for you?
So what drew me to occupational therapy was being able to help patients, like you said, regain function and just seeing their overall progress and all that.
Sure.
Yeah.
I didn't know if you had like a family, because sometimes some people get involved because families. Like I had an aunt or someone who did it, and I said, you know what, that's where I want to go. I didn't know if you had maybe a personal thing
No.
there, but I'm kind of curious. I mean, the people that come in, are most pretty gung ho, or most kind of, and I imagine each scenario is different. You get people, maybe older folks might be having that mindset of, well, I'm done anyway. Why am I doing this? And then, I mean, is that something that you deal with a lot, where you have to be the kind of the motivating factor? Yeah, you're breathing, aren't you? There's a reason why we're doing this, and you need to do that. I mean, is that something you deal with a lot?
No, we don't really. The people who come in our clinic, they are real motivated
Good. I was wondering about that, because I just, I can imagine some folks when you get older. I mean, we're all getting older, but now that I'm, on the 50 side here and looking around, you kind of think like, all right, at one point you're just like, I'm at this certain age, it's supposed to hurt,
Right.
Yeah, and so I didn't know if you got people that had that mindset, and you're saying, no. It's you got an old car, you just accuse it to not. Oh, the oil always burns, or do you fix it?
Right.
You fix
Yes,
it. That's
sir.
what it does. So, let's talk specific about some of the services. What the nuts and bolts, actual conditions and things that people come to your office to get treated for, to get rehabbed on.
So we do a lot of ortho cases, hips, knees, shoulders,
Okay.
carpal tunnel, tennis elbow surgeries, and a lot of ortho cases is
Okay.
what we deal with. And
most of that's probably just degenerative over time, sports related stuff generally, right? Or is it is some of that dealt with illness and like your stroke conditions and things?
it's more sports related and
Okay.
degenerative
Okay.
conditions.
Yeah, because you're dealing with like strokes and things. That's more motor skill type rehab. It's not like a physical problem with the muscle or the bone per se.
Right.
It's the connections from the brain to that arm, leg, whatever it is, and they're not firing right. And you kind of have to retrain the brain and say, no. This is when you're as your brain is telling you to pick up that cup. This is the path you want your brain to take it to go pick up that cup. Right now, it's going, and then it goes somewhere else, and you're like, I can't do it, and we got to retrain it to. That's kind of what you're doing, is kind of basically getting the maps realigned back up for them inside, so that the brain knows where to send these signals and send these various commands and what have you.
Yes, sir.
Golly. And is that really repetitive? Is it? I mean, is that? Like when I think about that, is it really just muscle memory? And you hear things like muscle memory. Is that coming into play in some of that when we're talking about why we pick up this phone right now or why we don't? Is that muscle memory as part of that, or things we refer to as muscle memory?
Yes, sir. That's what
Okay.
we refer to. Yep.
Okay. Now I'm curious. Muscle memory. What does that actually mean when someone says that? Because I know the memory is not in the muscle; it's probably more on the firing the nerves and all that stuff, right?
Right.
Gotcha. But it's just easy to say that. But that's really what you're dealing with. Do you deal with because we think of stroke patients and things, we think of older patients on that. But do you have a lot of patients that are younger or stuff that are dealing, maybe not stroke per se, but similar type symptoms? Or some, like they're having motor skill issues, things. It's not stroke related. I mean, but do you still have younger folks that deal with those where maybe it's autism, maybe it's another reason that the motor skills aren't working the way they're supposed to?
Yes, we do deal with younger folks as well.
Okay.
Yes, sir.
I'm just curious on the autistic side. How does that kind of work because when I think of the physical therapy, it's repeat and things, is it much the same for autism? Or is it a different path you kind of have to do to connect and make those breakthroughs, so to speak?
Well, there's a lot of different levels of autism. So, I mean, depending on the severity of the autism,
Sure.
is kind of based on our treatments. And
Gotcha.
Yeah.
I just didn't know if it was the same neighborhood of treatments or it's a different animal altogether. You know
it's
what I
a
mean?
different animal altogether.
Gotcha.
Yes, sir.
Whereas, like, in essence, these other folks, something happened to cause that problem.
Right.
Where these folks are born with it, so I didn't know if the problem looked the same on the inside, if that makes sense.
Right. Yes, sir.
I'm not a doctor, so these terms are very technical, you know. But really, on the average day, you're dealing with people that, you know, knee rehabs from surgery or a hip replacement or something like that.
Yes, sir.
And I know enough to know I've had nothing replaced yet or nothing like that I've had to do, but I know enough to know the success and the question of was it rough or was it easy? Almost always the answer to those questions are resolved in the rehab side, right?
Yes, sir.
That's where generally people talk about a hip replacement or a knee replacement. They're kind of, oh, that was rough, or no, that was easy. And odds are pretty good. The folks that said they had very little problems, they're the ones that listen to you, the therapist, that says you need to do these exercises on your own time. You need to eat, or, you know, you can't walk, or, you know, whatever restrictions or requirements you put on them. Because I know a lot of us will have a knee and we get boneheaded and we think, all right, we're fine. I'll walk up them steps and stuff. But you're not 100%. We're rehabbing. We're getting it back to the way it was before. You can't just go and start running triathlons on this thing. We got to get you there. And so I'm guessing most people that have like reconstructive surgery or any of these types of things, or even stroke rehab, anything like that, the ones that do what the therapist says and follow the aftercare generally have a much less hassle laden recovery experience.
Right. Yes, sir.
And I was just curious, is that probably your biggest problem you have when you have setbacks, is really people not
following
doing their homework, so to speak,
yeah,
and
not following through. Yes, sir.
So if I could give you any advice, if nothing else today you take away from it, if you have any kind of reconstructive surgery or rehabilitation type procedures, the follow-on care is the key to success here. That's the hard part, is that part. It's not the actual surgery where they're going in and moving the ligaments around or doing whatever. That's easy. That's an in and out couple hour deal. The real healing happens after that's in place, and as we rebuild the joint, the muscle, and get you to a point where that's serving you as you would before.
Right.
So please, when Rocky tells you to do something, it would behoove you to do it,
right,
because he's just doing it to make your life a little bit easier and a little bit. You guys have tried and true methods, you know, and I don't know, everybody's different. You know, everyone's got unique things, but at the end of the day, the rehab, the things you're teaching them, it does work. You've got to give it a chance.
Yes, exactly.
And I was just thinking, you have one of the more unique, and I guess this is true with all, you know, doctors and medical procedures, but less people are going to argue with the doctor about your meds to take and all that, whereas they'll come to you and be like, I don't need to do that. My knee, you know what I mean? It feels like people are willing to test the boundaries more at a rehab versus just going into their primary care physician to, you know, talk about whatever medical condition they have. Am I close on that? I just kind of feel like your homework people like to blow off because it involves walking or moving your neck or doing, and people don't understand the value of it till they don't do it. Does that make sense?
Like I said, the majority of our patients, they come in, they're real motivated. They want to get better. And
okay, I guess I just do a lot of cocky people, because I could just see people going in. And it's like, yeah, I'm going to really do this for 3 hours or whatever you're telling them to do.
Right.
You know, I've done it, and the few times I've had like a shoulder thing, and it, not enough to warrant seeing a specialist, but just go and seeing your primary care physician. So yeah, you got to pull muscle, whatever it is. But in essence, there's not much you can do. It's like, right, you know, so he's telling, just do this, and you keep working it. And I'm not going to lie, the first time I was like, whatever, you know, but then I started doing it, and sure enough, I was like, yeah, pain's starting to do and everything. There's something to this. I didn't know if people were like stubborn like me or more receptive to being.
There's some out there like that.
Yeah. 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 We live in that world sometimes here. As far as other advice you would give patients and things right now, other than just your follow-on care, is there any other tips or things that your patients could do to kind of make the entire rehab process easier or better for them?
Just follow through with the therapist and work closely with your doctor to, ensure everything's healing correctly. And
sure. How much does diet come into your I mean, I think most of us think of therapy and all that. We think the physical side, but how much of your job is talking diet with these folks and things like that? Is that a big part of rehab or physical therapy, or not so much?
Not so much.
Okay.
No, sir.
Okay.
Yeah.
I didn't know. So if you got one doctor harping about you eat too much red meat or something, Rocky's not going to give you a hard time about that.
Right.
Good. But he is going to work you.
Right.
He's going to work you, and you come ready to work, and you come, come in your sweats, I guess, for a lot of folks. Come in your gear and sweats, and then doing that aftercare. But that's the thing. And I think at the end of the day, your probably job is as much the coach as it is the actual expert in the room on the medical science behind it, too, is that day. Because at some point, I think all of your patients probably hit a wall or something. You know what I mean? A part where maybe they're not seeing the progress as fast as they hoped, and they get frustrated and things. And then you have to be there to say, no, you got to keep the nose to the grindstone. It will pay off. You just got to keep doing it. And that's the big thing about your industry, is you really have to make sure those patients stay on top of this stuff.
Yes, sir.
Until we get to that point in like Star Trek, where they had that little thing you just waved over everybody and fixed everything.
Oh, yeah.
Remember the little tricorder looking thing? Until we get that thing, you're going to have to do rehab on your knees and your back and all those things.
Yes, sir.
Good deal. Is there any information about that we wanted to talk about that we didn't get to? Anything about? We'll get the contact information here, but just as far as services you provide or some of the things that you can offer that we haven't really covered yet.
So we do wheelchair evaluations.
Okay.
In the clinic every second Thursday of every month.
Okay.
Yes,
and so
sir.
is this kind of like I think of car seats for kids? Like every time they have those car seat checkpoints where you can kind of make sure that your car seat's installed and is working properly. You guys offer this in essence for wheelchairs.
Yes, sir. Every 5 years, a patient qualifies for a new wheelchair, and so typically we do the evaluations, and then we have the wheelchair person that comes down with us, and we do all the fittings. And,
the work on it.
Yes, sir.
The nuts and bolts of the wheelchair, that kind of stuff. I imagine is that like, because sometimes people may have a wheelchair, they just getting older, and they went to like a thrift store or someplace and found a wheelchair. Do you get people who will come in and bring those in and say, is this a serviceable wheelchair, or should I just got ripped off? Yeah.
So
does that happen? Is that part of this too?
Yes, sir.
Okay, very good. Because I mean, it's not very often that you see wheelchairs and things, but it is sometimes it happens, and I think most people get them through their medical supplier or through their own doctor or things like that. But on occasion, people do that stuff. So, but like you said, what dates do you do that again? I'm sorry.
The second Thursday of every month.
Second Thursday of every month. So that'll be May. Will be the next one.
Yes, sir.
So. Very good. Again, call his office to schedule an appointment, or if you want to ask any questions about the wheelchair servicing or anything like that, 575-625-3372. That's Rocky's office number here for the for physical therapy there.
Yes, sir.
And then call and schedule an appointment, or if you have questions, I'd about to say schedule an appointment's probably done through your primary care physician or specialist. But if you have questions about the wheelchair, or you know what? Even if you just have questions about service, maybe you have a knee or something, and you're like, well, I know the surgery. I want to know what's going on afterwards. Don't hesitate to call your office, talk to some of your staff. They'd be happy to give you kind of the information on what to expect on all that kind of stuff, too.
And we also do total joint pre-op classes as well.
Okay, so if you're getting ready to have a joint replacement, you guys do like classes on what to do beforehand?
Yes, we do. We do classes on what to do beforehand.
I didn't know there was prerequisites on some of that. What type of stuff are generally required for people before they have like a joint replacement?
So we usually go over the exercises to do prior to surgery.
Okay.
And then what to expect during surgery and after surgery.
So it's really just an informative thing. It's not like you have to. I mean, yeah, there's probably some stretching, various things that might make it a little less painful for the process and the afterwards, I should say, in the rehab side. But the rest of it's just, okay, this is what. So on surgery day, you're not shocked or surprised or like, why are you doing that? Everything that's going on.
Right. Yes, sir.
Very cool. Excellent. So please reach out. Please come in. If you've got these issues, start the process. If you've got the nagging injuries, those things, talk to your doctors. Talk to your primary care. Let's get it looked at. And maybe they can set you up to here and get you seeing Rocky Rodriguez here and get you fixing these problems that you've been, if it's surgery that's needed, or maybe you go right to the rehab. Maybe it's like we don't need surgery, but if you spend some time with our occupational therapist here, he can give you some exercise, some treatment, and we can get a little more life out of that knee for you or whatever it is. You know what I mean?
Yes, sir.
Do you do a lot of that where we're not ready for surgery yet, but let's do some stuff to kind of make it stronger and buy you a couple years before ultimately we're going to have to replace that knee? Do you deal with that kind of stuff too?
Yes, and it's typically the insurance tells you have to do therapy before they even
I understand that.
do an MRI.
They're like, I ain't spend the big bucks for it. Is you sure it's bad? Let's check it out. Let's go. Yeah, I get you.
Yeah.
Insurance. We all answer insurance at some point or another, don't we? It's the world we live in. So, but folks, if you need help here, there is an option for you here in town. Lovelace has you covered. Come on by, talk to. And by the way, if you go to the website lovelace.com, you can go and research all the services through Lovelace, including occupational therapy and physical therapy. So if what we're talking about here isn't your problem, but you got some other issues, maybe you need a cardiologist or endocrinology or any of these other very popular places where people need, Lovelace has you covered there too, and you'll find it all at lovelace.com.
Yes,
but,
sir.
But if you want to talk specifically with Rocky's office, call direct 575-625-3372, and you can get talk about referrals or any of the questions that you have there. Or if you just say, hey, I heard you on the radio. I would love some information about what you guys do. Can you kind of fill me in a little bit? And they'd be happy to talk to you. I always say, especially when it comes to your own health and things, ask questions. There's nothing wrong with asking questions and wanting to know what's going on. Trust your experts, absolutely. They're the experts, but it's nothing wrong to, it's your body, it's your life. You should know exactly what's happening to every part of it.
Yeah, exactly. Yes, sir.
And that's what you guys do, is take care. And I got to ask this question because I do this. Any rumor or any luck on burritos back at the hospital yet? Is the cafeteria out serving burritos yet? Because in case folks don't know, Lovelace Cafeteria, they got good food, but something about their breakfast burritos but COVID's kind of shutting that down, and people go to the hospital just to eat lunch, or did before COVID. And I know that sounds weird, but that's true. And so I was just questioning if are those burritos making it out yet, or is it still kind of calmed down because of the COVID stuff?
I think the cafeteria is in full
nice
swing. Yes, sir.
So get your burrito on. Maybe that's the carrot you dangle.
Yeah.
I'll make you an appointment in the morning. You come in at 8:00. We'll get you wrapped up, and then I'm gonna prescribe a burrito afterwards.
There you go.
I like it. Excellent. Well, thank you as always, Rocky. I appreciate it. I'm sure you got a bunch of patients waiting on you, so probably should get you back to work here. But again, if anybody has any questions about anything we talked about here, Lovelace.com, you can go there or call his office direct, 575-625-3372.
Yes, sir.
Thank you, sir. Appreciate it.
Thank you.
And it wasn't so bad, was it?
No, that was good.
Good deal. It's not as bad as, never mind. It's not like a colonoscopy or nothing. Although I've had a bunch of those lately. They're not so bad either. So, but thank you. Appreciate you.
Thank you.
All right. It is 9:40.